Hi, I'm Dr. Craig Miller, and here at Loyal Companion Animal Care, we're very passionate about dentistry. So today I'm going to talk to you about what's involved and what we're doing with a professional dental cleaning on your pet. So what exactly is a professional dental cleaning? A dental cleaning involves completely scraping the tooth, and usually we're using an ultrasonic scaler or a hand scaler, and these are sharp instruments to completely remove not only the tartar but also the plaque on each tooth. Then we follow that up with polishing the teeth completely smooth because cleaning it creates little micro abrasions on there. So we polish those off. Um, and then I put on my dentist hat, as I call it, and I do a full oral exam on your pet. So checking the health of every tooth, checking the health of the gums, and all the surfaces in there. So we get a very in-depth look. And then also, very important part is taking x-rays, or what we call radiographs, of your dog's and cat's teeth, so we can see what's going on underneath the gum line, very similar to what happens when we go into the dentist. So I get a lot of questions about when do we need to do dentistry on our pets, and the truthful answer to that is it depends. It depends on the breed, the age of the animal, and also what the owner is doing at home. So if you're doing home care, such as brushing, cleaning, and dental chews, that will help spread out how often we need to do those cleanings. But it's really an individual question. Some animals need it every 9 to 12 months, and other animals need it every 2 years. In general, as they get older, they will need it more frequently. And in general, the smaller the animal, the more frequently they need those cleanings. I'd also like to compare anesthetic dentistry versus what's called anesthesia-free dentistry. Um, Dentistry in terms of the American Animal Hospital Association, the American Veterinary Medical Association, and the American College of Veterinary Dentists, to effectively do a cleaning of the teeth, you have to do it under anesthesia. Our pets just do not sit still long enough and still enough for us to safely use the instruments that we need to clean all surfaces of the tooth, and even more importantly, actually to clean underneath the gum line, which is where the bacteria are going to cause problems with the attachment of the tooth and potentially get into the bloodstream and affect your pet's overall health. So another benefit of anesthetic dentistry, besides being able to clean all surfaces of the tooth, is the fact that then we can do a full oral exam without the pet struggling or moving, and also so we can get diagnostic x-rays of the teeth, which is very important to find hidden disease because there's a lot that lies beneath the gum line that we cannot see on an awake patient. And those dental x-rays are the same as we take when we go into the dentist, where we've got to put a plate inside the mouth and the patient has to sit very still while we're taking that x-ray. So there's two dangers really with anesthesia-free dentistry. The biggest is that we will miss something that we cannot see without dental x-rays and without the patient being still while we're able to probe each tooth. And the probing is, again, very similar to what the dentist does when they're examining our teeth. And the other concern is the potential dangers of causing serious harm to your pet. If your pet were to move while someone was trying to scrape those teeth with the sharp hand scaling tools, they could cut the gums, and in fact there are many case reports of animals having serious lacerations to the mouth and the tongue of animal that can lead to very dire consequences. So I hope this video is very instructional for you as far as what's involved with anesthesia, dental cleanings, oral exams, and treatment as we're trying to keep your pet as healthy and live as long as possible.